Hi, Kimberly Cunningham here, and I want to answer a question we've been getting a lot lately, which is, my doctor said my thyroid was fine, but I still think my thyroid isn't functioning. And here's why traditional annual Western labs might miss a dysfunctioning thyroid. So I'm just going to go over a little bit of thyroid anatomy, physiology, and how we can make it work better. So the thyroid is a gland, an organ that is also a gland that exists in your neck. The thyroid produces something called T4, which is a thyroid molecule surrounded by 4 iodines. That's why it's called T4. About 80% of what comes out of your thyroid is T4. You do convert a little bit of T4 to T3 in the thyroid, but predominantly that happens out in the body. So when you only get a TSH, or thyroid stimulating hormone lab, all you're checking is the thyroid producing enough T4. And that's not enough information. That's not a complete picture, because your thyroid gland itself might be just fine, but we haven't checked the system yet. So here's what comes next. T4 comes out of the thyroid, which is that thyroid molecule with 4 iodines attached. Then there's enzymes, deiodinase 1 and 2. There is a third one. It's more complicated. We're just going to talk about the basics today. So deiodinase 1 and deiodinase 2 are enzymes. D, take it off, iodo, iodine, ACE, an enzyme. So that cuts one of those iodines off to make T3. Now, T3, when it's unbound, is what will bind to ferritin, which is what you get from iron, and that T3 plus ferritin combination, that is what goes into the cell. That is what gives you a metabolism, regular bowel movements, hair quality and quantity, and the ability to maintain your waistline and not constantly gain weight. So the symptoms of low thyroid function are the same as hypothyroidism. So hypothyroidism is where the gland is not producing enough hormone. Low thyroid function is where the system isn't working. And it's actually called low free T3 syndrome. It is a different diagnosis. The TSH only catches whether or not the gland isn't working. So we want to make sure we get the entire thyroid panel, which is going to be a TSH. We do want to know if the gland itself is working, but we want to get that all-important free T3. What is free to click into ferritin? In women, we always want to get a ferritin as well to make sure that transport molecule, that clicking in, happens. And then we also want to get TPO antibodies to make sure we don't have an autoimmune process going. And so that's a complete thyroid panel. So when someone comes in and says, I just know it's my thyroid, but I had it tested and it was fine, I'm so confused. If we didn't get the entire panel, we didn't check the system as well as the gland itself. That's a functional medicine lens looking at thyroid health, and that's what we do here.